People get so focused on these devices that they end up holding their neck and upper back in abnormal positions for a long period of time. Enough so that people have coined the phrase, other folks have coined the phrase text neck, which is essentially referring to postural pain, muscle pain, neck aches from frequent or overuse of these sort of devices where they're holding their head in an abnormal position. What we know is when you hold your body in an abnormal position that it can increase stress on the muscles. Certainly you can get fatigue, muscle spasm, even stress headaches. What we assume but don't necessarily know is whether or not this is causing long-term increased stress on the other structures in your neck, such as your discs or the joints in your neck. If that is the case, potentially it could be setting you up for further problems later in life in terms of your discs, but we don't have any good research on that right now. So normally our neck has a normal curvature like this. This is looking at your spine like mine would be, where you'd be facing that way. This is the base of the skull or the head. So normally our neck has a curvature like this, and then our upper back curves the opposite way, and then the low back curves the opposite way again, and our body's made that way to absorb stress and function properly. When you're in an abnormal position for long periods of time, what happens is the head normally flexes forward, such as this, and you can see how that would increase stress on the front of the disc specifically, and thereby increase pressure of the discs wanting to go back. Additionally, you're stretching or causing some stress on the posterior facet joints, or the joints in the back of the neck. All of this is how our spine is supposed to function in terms of movement. However, certainly we weren't made to have our spine in a position like this for long periods of time without changing positions. In my opinion, there's really three main ways that we could address this issue. One is, if you're using technology or some sort of smartphone or other device, would be to try to set up the place that you use it similar to we would do with a workplace modification. So instead of having it in your lap and looking straight down, find a way to modify your phone or your iPad or laptop so that it's up more at a neutral level so your head can be more straight ahead. Similarly, your arm positions can be at a 90-90, nice neutral position so you're comfortable. And with these new smaller technology devices, I don't think people focus on that as much, which we used to do with our regular desktops. So that's one, is to have it in an appropriate position so that your body's not in this really abnormal position, and just be aware of it, that you're in a more neutral position. The second thing would be to take breaks. Most of us are on these devices all day. When we're driving, we're looking at them, and before we take off in the car, we're looking at them. During our break, everybody's on their phone. And so I think being aware that we're using these technologies all day long and just forcing yourself to take a break, change positions, or alter your position would be important. So maybe limiting your total exposure to these devices. And then the last thing is being physically fit. So aerobic exercise and being physically fit in terms of a strong back and neck and a flexible back and neck help us deal with any of these abnormal stresses. So in general, people that are very fit tend to have less musculoskeletal complaints than other people. It's not that they're doing other things during the day, they just don't tend to feel the pain as much. And I think their bodies are more prepared to deal with those stresses.